We're going to continue the theme that Yuka and Jeff have set for us by thinking about leadership in health and safety now, particularly with regard to COVID-19. Davide Scotti is head of HSE communication and training at Saipem in Italy and also at the NHS Foundation. Davide, good to have you with us, my friend. Go ahead and share your screen and tell us what you have to say.
Hi, Andrew. Good afternoon, everyone. It's a great pleasure to be with you and to share some reflection on my area of expertise and my area of interest, leadership in health and safety. I don't have any slides for you, so you can don't worry too much about reading slides. You can double click if you like to see me bigger. And yes, I think COVID-19 really challenged the status quo of HSE. Because come on, as HSE professional, we came from a time where we always had to fight hard to make health and safety to be perceived as a value. We fight hard against this general culture, this general perception where health and safety is perceived boring, not interesting, just a cost, something not comfortable to wear, and so on. Now it's different. Thanks to COVID-19, with all respect to the devastation that COVID-19 brought into the world, but thanks to COVID-19, the HSE professionals became more demanded, more requested from the senior leaders who needed support and guidance to get through this pandemic, and also from the workers that now have started to have different expectations from the HSE professionals. So this is a change that certainly challenged the status quo of HSE. We have learned in the past 3-4 months how important is collaboration and sharing. I think the collaboration and sharing of the global HSE community has been fantastic, as Andrew mentioned in the beginning. The generosity, the level of interaction, of helping and supporting each other in our community globally has been amazing, and I really like and enjoy to notice that. And of course, the challenge is not just for us as HSE professionals, but the challenge has been for everyone in a leadership position. Policy leaders, industry leaders, organizational leaders, everything happened very fast, and the responses had to be very fast. Pope Francis reminded us at the very beginning of the crisis that no one is saved alone, and I always like to remind the people around me that no organization is saved alone, but actually organizations are saved by the leaders who operate in those organizations. And when I say leaders, I mean formal leaders and informal leaders, of course. And in moments like these, in VUCA moments, volatile moments, uncertain moments, complex moments, ambiguous moments, like the one we went through, of course, leadership is fundamental. It's fundamental to have a vision, to have a long-term vision. It's fundamental to communicate effectively and transparently. It's fundamental to be able to influence, to build trust and credibility around you. This is the moment where real leadership is needed. And when I say real leadership, I mean health and safety leadership, because what is the difference between a leader and an health and safety leader? To me, there is no difference. A real leader is also an health and safety leader, and an health and safety leader is certainly a real leader. So, yeah, this is the moment of leadership in health and safety. Those organizations who had already a good safety culture implemented certainly went through this VUCA moment in a much better way than those organizations who didn't invest in safety leadership and safety culture in the past. And yes, everything is changing. Everything is very fast. We have entered the time of more with less. Actually, I don't think it's just about to do more with less resources, but it's about to do things in a different way, perhaps with less resources. And what will be the future? There are great questions that are being asked to the previous speakers, and I don't think we all have the answers, but I think it's very important to ask these questions ourselves as leaders. Leaders today need to ask themselves powerful questions, we need to ask this question to the people around us. You know, somebody were mentioning about the behaviors, you know, that we have learned to practice in the past few months. You know, all these social distancing, all these behaviors. I mean, what impact they will have socially, mentally, organizationally? I mean, the future will be better or be worse? People will take care more or will take care less? I don't know, but it's good to ask. It's good to ask these questions. And today, leaders, as I said, needs to ask this question. Today is the moment where leaders are watched. Today is the moment where, you know, leaders need to be very, very careful. Of course, we are leaders in our community. We are watched. We need to be very, very careful. But I think one of the key responsibilities of our job is to help and support our organizational leaders in discharging their health and safety leadership in the best and most effective way. I think safety leadership is now more important than ever, because probably will help in addressing key and fundamental questions like the one I mentioned earlier on, like the one you mentioned earlier, and like those questions that, you know, they will come up to our mind when we are focused. Because I think one of the key thing on asking yourself powerful questions is that this generate focus, and focus to me is the best antibody against the virus of disattention. Because come on, we are all familiar now with this terminology, pandemia, epidemia, but viruses. Come on, as an HSE community, we always fought hard against the virus of disattention. That to me is the biggest, how many people have lost their lives or injured themselves or others because of lack of focus, because of disattention, because of complacency, and so on. And come on, focus is fundamental. This is the moment of focus. This is the moment of innovation. This is the moment of courage to challenge the status quo. This is what we need to do as an HSE community. If we deliver this conference before COVID-19, or if I delivered any type of training, seminar, workshop to the leaders of my organization or industry leader, I would have probably talked about numbers, you know, the number of people that every day dies at work in Europe, 10, by the way. You know, I would have probably shared stories, films, things to emotionally engage and touch people in order to raise the level of health and safety. But come on, stories are not needed anymore. Stories are not needed anymore. Now the risk perception, generally speaking, are raised a lot thanks to COVID-19. You know, generally speaking, leaders, entrepreneurs, workers are much more sensitive about health and safety issues, are much more sensitive about the protection that they expect the company to give themselves. So this is the moment where we need to guide our leaders, our organizations in the best way to support the creation, the generation of a stronger safety culture. Yeah, this is something that as HSE we always did, we always fought hard to do, but we are in the best time ever really to accelerate the change, to accelerate the implementation of a stronger, mature safety culture through safety leadership. Safety leadership, yes, fundamental, but also let me add a second element that I think is fundamental to inject into the organization, and this is what I like to call the individual social responsibility. Yes, personal accountability is fundamental. I like to call it individual social responsibility, because now, more than ever, we are learning that our actions or our non-action can have an impact not only on ourselves, not only on the people around us, but indirectly can have a bigger and stronger effect. So we need to communicate this idea. We need to help people to understand the importance of adopting certain non-negotiable behaviors in order to protect themselves and indirectly everyone has. So it's VUCA time, everything is changing, everything ambiguous. You know, the nature of this small intervention I'm giving to you is to generate more questions. I don't have the answers, but I like the idea that, you know, we can keep focusing on growing, on innovating, on supporting the organization we work for. And I would like to share with you a short video which I produced through the LHS Foundation, the Leadership in Health and Safety Foundation that we have created in Saipem 10 years ago, in order to share, you know, also externally our passion for health and safety, and also our tools, methodologies, and so on. So 1 year ago, we produced a video, just a public video, to help in the thinking about the future of safety. In fact, the title of this video was Safety for Future. And it's a video that we produced 1 year ago, but now, after COVID-19, is more actual than ever. So, if you allow me, I would like to share my screen and play this video. I think is the best way to end this intervention. Let's see if it works. Can you see something?
Not yet, Dominic.
Not yet? Not yet. Why? Condividi, share. Okay, now I think you'll be able to see something. You confirm?
No, not yet.
Are you sure?
Now it's coming by the
Okay.
streaming now.
Very good. Enjoy this.
So for participants, you might just want to look for that second video screen from Davide Scotti. Double click on that one, you'll be able to see the video.
Okay, I will start again, so you can do that. And please enjoy this video, just 2 minutes, but I think is powerful.
Change used to be gradual. You could see it coming, analyze it, and even embrace it. Not anymore. In our hyper-connected world, change is exponential. When things move so fast, it's hard to know what decisions to make. Things you could only imagine yesterday are real today. Collaborative robots, artificial intelligence, Internet of Things, self-driving vehicles, bionics, virtual and augmented reality, wearable technology, big data, 3D and 4D printing. These innovations amplify one another to create a perfect storm of change. What impact will technology have on the way we work and live? What will the consequences be, and what challenges will it pose for health and safety? If robotics and automation may mean people are less likely to work in dangerous environments, the digital workplace will have consequences at a social, psychological, and organizational level. Just think about the possibility of continuously monitoring workers, the management of work using algorithms, as well as the increase in ergonomic risks caused by new human-machine interfaces and the increase in online and mobile work. Let's make sure this relentless process of innovation doesn't overwhelm us. Let's take the lead. How? By staying human. In the vortex of change, you need...
Oh.
Human characteristics like creativity, imagination, intuition, emotion, and ethics are the only things that remain constant. Values like honesty and justice, the ability to come together and cooperate, feelings of friendship, trust, and love, the search for happiness and safety. All these things describe the endless frontiers of human life, a picture that machines will never draw. Technology will certainly lend us a hand more and more, but it will never replace the human heart. We need to learn to know and understand technology without being afraid of it. Only then will we make the best use of it. As the futurist Gerd Leonard said, the future is in technology, but the bigger future lies in transcending it.
You can access this video from YouTube. It's free. Now okay, I think you're back with me, yeah? So, just to close up, as we said in the video, yeah, technology will always give us a hand, and through COVID-19 we have learned to use technology much more than before. This is great. Let's use it, let's innovate, but let's also be reminded that the technology, although will give us a good hand, will never replace the human heart. This is something we have to put in anything we do, as HSE professionals, of course, but we need also to help our leaders, our managers, our workers to do the same. Is a time COVID-19 generated a situation where our leaders are watched by a much more sensitive audience. So this is the time of less talking and more practice. Behaviors are fundamental, credibility is fundamental, the ability to play human leadership is fundamental. So let's bring focus, let's bring courage, creativity, innovation. Let's ask ourselves questions. Let's find the answer, where hopefully the vision should be to address or to achieve the best ever possible answer. That is a better, a safer, and a healthier world for everyone. Thank you very much, and any questions, happy to share.
Thanks, Davide. We've got a couple of questions on the chat. Remember, you can type your question in using the chat box, or you can turn on your microphone or give me a little wave to indicate you have a question, and then I'll ask you to share the question. So, Davide, first question comes from Maurizio Rigorio. Maurizio is saying, during this emergency, we didn't really have great lessons from leaders in Italy as well as in the rest of the world. We saw politics, scientists, and economists arguing with each other, saying one thing and then exactly the opposite the day after, lacking in taking decisions, etc. We saw in practice the unpreparedness to respond to an emergency, which is one of the main topics with which we HSE leaders deal with every day. So do you think that after the pandemic, leaders will be more prepared for the future?
I hope so. In Italy, I know very well what Maurizio is talking about, because I experienced the frustration of seeing what we went through, the infodemia we went through. I don't know if it was the same in other countries, but certainly to me, it was the demonstration that lack of communication and lack of leadership generate chaos. So we had an example in Italy where we can say that we live in a country with a strong communication culture, because we are unable, generalizing, to communicate effectively, and we are unable, in my opinion, to lead effectively, at least at that kind of level. I think in the organization, in the industry, there are much better leaders than those that go on the television every night, and perhaps we cannot change the world, perhaps we cannot change the country, but we can change our organizations and play effective leadership within organization and influence the behaviors and the culture around us.
Thank you.
So.
Just a reminder to participants, there's a lot of background noise. If I could please ask you just to mute your microphones so that we only hear the speaker when they're talking, please. So just click the microphone button at the bottom of your screen to mute your microphone. Thank you. Nassim Benedin asks, Davide, how do you maintain momentum of safety, being the centre of the organisation's concern? What advice do you give to EHS professionals?
But generally, or in this moment in time, because I think this is a general question in all the time. Health and safety is something that the more you do, the more it comes. It's an endless process. So I think we need to keep momentum this is the best moment to keep momentum, because as I said before, the audience, our audience, being leaders or being workers, are much more sensitive than before, are much more vulnerable, if you like. So If in the past it was more difficult to get across the safety message, now we are in a better condition. So let's keep this momentum. Let's communicate. Let's get our leaders to communicate, okay? Because let's remember, we are just HSE professionals. If we want to create a stronger culture in the organization we work for, we need to get our leaders, our operational leaders, our senior vice president to cascade the message in the most effective way, not only those, but at every level. So let's help them to cascade the message. Let's help them to communicate effectively. Sorry?
Let me put you on the spot, if I may. Nasser's asking for practical advice to maintain momentum, but I think what I've heard you say is, yes, we need to keep momentum going. What one thing should EHS professionals be doing right now to ensure they maintain momentum? What one thing do you think is most impactful?
Get together with your senior manager and drive together a strategy where he can deliver powerful messages. This is the time where people need to hear and see the leadership from those guiding the organization. So this is the moment to sit with them and help them to communicate effectively. This is what I would recommend.
What does that look like in practice, though? Because I don't want people sitting here thinking, okay, I need to get together with a business leader, but what should they do? What should the message be? Could you give an example of what words are needed here? What behaviors are needed by these leaders?
This is the moment where I saw great leaders, great organizational leaders, to use platforms like this to communicate to the entire organization. Things that before were difficult even to think about it, now they are possible because we have made more muscles in using these technologies, using the streaming. So to me, something very practical that we did in Saipem, that I saw doing from other organizations, is to have streaming, cascading event where you communicate in a very transparent way with all your people, and delivering a message where, of course, people need to understand what's happening, what are the vision, what is the strategy. I'm not going to give you the script of what should be said, but probably you know what are the messages that your organization needs at this moment in time. But I would use this streaming to reach everyone.
Good idea. Thank you, David. 2 questions left, but only 2 minutes to answer them in. So quick answers if you can, and we can see if we can get through them both. Giuliano is asking, in terms of innovation in a short time, what is or will be the main focus to take safety culture to the next level, do you think?
In terms of innovation, again, I think is the evolution of training, the evolution of HSE training, using what we learned, that it can be possible now with this digital platform, and I think there is a great scope for innovation in all HSE training, and also creating online training experiences that can cost less and be equally effective.
Okay. Back to Nassim Benedine, who has a second question, saying, how to adjust the leadership style in the time of VUCA, volatile, uncertain, complex, ambiguous, where the long-term vision means nothing?
What do you mean when the long-term vision means nothing? If the long-term vision means nothing, we have a problem, no? And
let's bring Nassim in. Nassim, why don't you just turn on your microphone and see if you can
sure.
help David understand.
Hi, Davide.
I understand.
Yes, sure. My point is where we have this level of uncertainty and volatile, and having the obligation to adapt constantly to the situation. How can we keep long-term vision up and running where we are constantly receiving new inputs and we have to be more agile? That's my message. How to adjust, to balance vision long-term with pragmatic VUCA operational, let's say, support.
To me, again, it's all about communication. To me, it's all about transparent communication, continuous communication. Sometimes I feel, but maybe it's not for everyone, that we miss opportunities for communicating effectively to our people. And to maintain, to make sure that the long-term vision means something, it's important to communicate the vision, to communicate the big picture. And communicating effectively, it can yeah, it can help in delivering the big picture, but it can also help in the short term, to keep people motivated, to keep people engaged, to keep people, supporting each other. So to me, communication is fundamental, and this is something that as HSE professionals we should do more, and we should help more our leaders to communicate effectively to their organizations. I'm not talking about our communication. Yeah, if we are mature HSE professionals, we understand how important, how vital is communication in the HSE. But we need to get the organization leaders to communicate effectively using any possible means, also new means like the ones we were discussing earlier. And this helps, in my opinion.
Thanks, Davide. Thanks, Nassim. Davide, Scotty, thank you very much for your presentation. It's almost exactly on time. According to our agenda, we've got time for a networking break now. Across on the left-hand side of your screen, you'll see a little button marked networking. You can click that in just a moment. Not yet.